get rid of SI joint pain by doing these 4 exercises. Let's get right into them. So first one is working our lats at the same time as working our butt across our side. So it's gonna cross our SI joint. And so we're gonna do a posterior oblique sling right here. Go ahead and start it. So what he's gonna do is use his lats to cross and use his glute. So we use the right lat and fire with the left glute, and then the left lat and fire the right glute. So he's gonna do a squat, a hip hinge squat, holding his lats and engaged right here. So when he's doing this, he's keeping his back in a neutral position while he's doing it, pushing his butt back, and then he's trying to slide his feet apart at the same time. Firing the glutes and then engaging to come back up. The whole time he's engaging his lats. When we do that, we have the fibers of the lat coming across and they go almost directly in line with the fibers of the glute, and that's gonna cinch up the SI joint. When we do this, we wanna do 10 reps, and we wanna do 2 sets. You can have anything with cables or anything. This is a band that's really good. We're just engaging those lats and then firing the glutes at the same time. If you know the right form, then you're gonna be engaging the right muscles. He's shifting his hips back. His knees aren't coming forward. That's one thing to look at. These knees are not shoving forward. If he shoves his knees forward, then he's gonna be using his quads more. So he's engaging the glutes, firing the lats, and that's exercise number 1. Exercise number 2 is, we call it a dog pull. So same muscles, posterior oblique sling, but we're firing the abs at the same time. So he's gonna put this band around his knees, and then he's gonna get on the ground. If you need a variation where you don't put pressure on your knees, let us know. Just comment and let us know. So he's gonna pull, he's pushing the legs apart, and he's gonna pull with that lat. So he's thinking about staying in a neutral position right here, maintaining, squeezing that back glute, and then he's gonna pull with this arm, pulling down towards his hip. Nice and controlled. Think about you have a laser pointer in your belly button. So you got a laser pointer in his belly button. It's not moving at all. This is a lot harder than it looks. This guy's just really, really strong. So he's pulling. We got that left glute really fired up, but what makes it fire up even more is that he has this band that's pressing against the other leg. So he's getting that contralateral pressure right there, so he can really fire up all the muscles in the glute. He's doing 10 reps pulling towards his hip, and then he's gonna switch sides. Go ahead and switch sides. That's the difficult part, just changing positions, and then he gets right in the position he wants. Neutral spine right here, squeezing that back glute, pulling that elbow down towards his hip right there, and he's gonna be engaging that left lat with the right glute primarily, so he's getting that cross pattern that we're looking for. Let's go to exercise number 3. Exercise number 3 is gonna be a side plank pull. So we're working the posterior oblique sling with all these. So go ahead and lay down. He's putting that band on, a little bit of extra resistance. You don't have to use the extra resistance. If it's difficult to do, we wanna get 10 reps. Major focus is not failing on these exercises. So he's coming right here. So good neutral position with the spine, and he's lifting up. He's using those obliques right here. He's pulling the knees apart. So he's separating the knees right here and engaging. And he's pulling right down, trying to put his elbow in that back pocket right there. Not using the upper trap. He's pulling down and back with his shoulder blade right here, and then holding himself up. This is a really tough exercise. You can do 10 and then do the other side. We do 2 sets of that one. It's a good rule of thumb with all of these when we're trying to spark up these muscles. We do 2 sets of 10, make sure that it's challenging, but make sure that you don't fail. Make sure we're not getting into bad positions when we do them. Exercise number 4 is dying bug. So go ahead and lay down on your back, Nick. So right here. Now when he's doing this, he's gonna be firing his hip flexors on one side and his hip extensors on the other side. So go ahead and do it. Lifting up, we're pressing down with the heel into the table. You can be on the ground. So he's squeezing that glute on the left side. Now he's using the hip flexors on the right side, and then he's resisting with his hands. His hands are resisting. So the primary motion is that he's using these hip flexors to fire up. We're getting that cross pattern so that we can cinch up that SI joint. Now he's gonna just bring it down and switch. Since you're at your house and you don't know which way the SI joint has gone, then we're gonna do both sides and make sure that we're firing up those muscles, because the SI joint should be a dynamic motion joint. So we do 10-second holds, doing 3 sets of this one. Switch. Now, if we wanna make it harder, we'll put this band on. And so when we put the band on, we'll go above the knee right here. And so now this just gets more glute engagement. Make sure that buckle's not on his skin. Now coming up. And then now he's got more glute engagement. When he's pulling up right here, he's still putting pressure against it, but because he has the band, he can engage the glute on the outside right here. So he's firing the outside of his glute med and glute max, and then squeezing that butt. 10-second holds, he's doing 3 on each side. This is just a progression to make sure we're firing up all the right muscles. Those 4 exercises are so important because we need cross patterns to keep our SI joint together. Now the SI joint is right here. When we talk about the spine getting out of alignment, it really can't get out of alignment because these facets knock together. But right here, we have a smooth surface for the sacrum right here, and this is the ilium. So the sacrum and the ilium, so we call it the SI joint, and it's a very common term people are talking about all the time because we see it very often. And so with a smooth surface like this, it can rotate forward, it can rotate back, it can be up, it can be down, or it can flare out or flare in. And so by activating these muscles, we're gonna be able to cinch that up so that we have stability for the SI joint so it can function when you're walking around. It's dynamic and it glides like this. So make sure that you watch the other videos on SI joint dysfunctions. We'll see you in the next video. Get mobile and stay active.